Hello, I'm Dr. Rachel Hall of Evolved Dental Healing, Holistic Dental Practice in Brisbane, Australia. And I'm just popping on live just to answer a few questions that have come up since I did my amalgam removal and mercury-free dentistry videos. And I've been asked a few times, what's the difference between amalgam-free and amalgam-safe, or mercury-free and mercury-safe? So I'm going to answer those questions today in this little live that I've just got happening before I have to return back to work and go see some patients. So I'm going to tell you a little bit about myself. First of all, I'm a dentist, obviously. I've got over 25 years experience. I've been working holistically since the year 2000 and running my own holistic dental practice since 2005. So this isn't something that I just say I do. I practice what I preach. I'm very big on holistic health and well-being, on living a life that's healthy and one that allows us to be free of toxins, take good care of ourselves and live a good lifestyle. So I'm going to talk a little bit today about amalgam-free dentistry and whether that's enough to take care of you. Well, there's many practices now who advertise that or state that they're amalgam-free, and that's great. What that means is they don't use silver amalgam fillings or fillings that have mercury in them. And it's great that they're choosing not to use it because it's not attractive, it doesn't look good in your teeth, it's not healthy for your teeth, and it's not healthy for you. But many of them are choosing not to use it, not because of the issues associated with the mercury that it contains, but it's because we want nice looking teeth. When you smile and when you laugh, when you're talking, you don't want to see big black bits in your teeth. It's very unattractive. So it's obvious that in the regard to having mercury fillings, the dentistry is heading in a new direction. Dentistry is now rethinking about the use and the safety of these fillings. In 2008 or thereabout, it was estimated that about 52% of general dentists no longer use or place amalgams in patients' teeth. Now that's fantastic. But as I said, the majority have stopped doing so, not because they felt amalgam was bad for them or that it was an unsafe filling material, but because of that push to have things that look more natural. Now that does provide a bit of an insight for the future of dental amalgam, and I think it's going to be that, within a period of time, we are going to be a mercury-free industry. But is being mercury-free and not using mercury-based filling materials, is that enough? Now I'm going to say, no, I don't think it is, but I'm just going to say hello, James. Thanks for joining us live. Hey, Lisa, good to see you here all the way from America. If you've got any questions or any comments, then feel free to just pop them in the chat and I can usually see them coming up. And if I've got time, I'll answer them before I go back to work. If you're watching the replay, thank you so much. Again, put your comments in, say hi. If you're enjoying it, then share the video. Let's get this message out there. So not placing amalgam is beneficial to everyone involved because it means we're not mixing it up, we're not exposing any mercury when we open the capsules or we're placing it. We're not polluting the environment with any of the scraps, and you as the patient aren't getting additional mercury added into your body via fillings that are implanted into your teeth. Now we know that significant amounts of mercury vapour are released when the amalgam is placed, but astonishingly, in fact massive quantities of vapour are unsafely is released when those amalgams are not being safely removed. So by not placing amalgams, this means that they're not using it as a filling material. So when they say they're amalgam free or mercury free, this is a great step in the right direction. And it's an important step, but it's only the first one. Now you might be wondering, why is that? Because mercury free dentistry doesn't mean that you're mercury safe. If you are still drilling out amalgam fillings or having that done in the rooms, mercury is being released, exposing you, the patient, to all the vapour that comes off. The bits are splattering around inside your mouth. You're absorbing it through your cheeks and your tongue, and the skin inside your mouth. You're going to be swallowing it and inhaling it as well. So when mercury is released from the filling, you drill on those amalgams, the amount of vapour that is released exceeds the minimal exposure limits, which are set as government regulation to say, look, if you get this exposure, then technically it's safe. However, there is really no safe exposure limit for mercury. There's no limit at which mercury does not cause damage in your body. Hey Joe, good to see you here. So when you're drilling on that filling, it's really important for the dentist to take the necessary steps. The steps that are going to prevent and protect you from mercury. They're going to look after themselves, their staff, they're going to take care of the environment. They're going to make sure that you're not exposed to mercury vapour during the procedure. Now, the only effective way to do this is to make sure that you're mercury-free and mercury-safe. Now, mercury-safe means removing those amalgam fillings irrespective every time with rubber dam, a separate air supply for you, the patient. The dentist should be wearing respirator masks, and so should their team. There should be special air filtrations used alongside of you so that captures any of the aerosols and vapours. There should be negative ions going on, and many, many things that you need to be what's called SMART certified. Now, SMART stands for Safe Mercury Amalgam Removal Technique, and it's by using these techniques that we can ensure that we're mercury-free and mercury-safe as a practice, and that's exactly what we do at Evolve Dental Healing in Brisbane. So studies have shown that dentists and dental assistants generally have elevated levels of mercury. They have higher incidence of fine tremors, that's where their hands shake, slower reaction times, and higher levels of mercury in their kidneys and their pituitary gland. Now, being exposed to mercury puts people at risk of many, many health issues. And so things like memory disturbance, dentists have higher heart rates, so just at rest the pulse is going faster even though they're not doing anything. We have higher nervous disorders, changes in our emotions, higher risk of insomnia, headaches, and higher incidence of emotional problems which can lead to divorce, and even incidences of suicide and depression. And these rates are higher than the general population. Female dentists and female dental assistants, sorry, I'm rushing because I've got to get back to work, they've shown a higher incidence of aborted pregnancies, so miscarriages, higher rate of birth defects with their offspring than the general population. Now, we can't say specifically that mercury is causing this, but we're certainly putting ourselves and our staff at risk in a practice that isn't mercury safe. So what does that mean for you as a patient? Well, what it means is that exposure to mercury can directly and indirectly contribute to or make worse nearly every symptom and health condition that dental patients have to deal with. So the mercury from those dental amalgams is believed to be a major contributor to health issues. There's also been talk about whether it's causing or adding to things like autism, ADHD, other learning and developmental disorders. Now, I believe that my patients, and that includes you, have the right to be protected from any unnecessary exposure to mercury at the dental surgery. So that means not using it and drilling it out safely if we have to work on teeth with amalgam in. So you want to be considering that just because a dentist says they don't use amalgam, is that enough to ensure that you're not getting mercury exposed while they're working on you? You want someone who's also mercury safe if your health and well-being is important to you. So I'm going to talk about the impact. Hey Kate, thanks for joining. Thanks for everyone who's here live. If you've got any questions, type them in. If you want to share the love, please give us some hearts. Share the video if you're getting value from this as well. Let's get the message out there about what it really means to be an amalgam-free and amalgam-safe dental practice where, you know, we're not going to expose you to mercury. So I've talked about the impact that mercury has on the dentist, on you as the patient, but it also has an impact on the environment. Dental offices are the biggest polluters of mercury into the water supply and ecosystem. At the moment, in a lot of areas of Australia, America, the UK, and other parts of the world where we use dental amalgam or we're drilling it out, it is not legislation that we have to stop it going out into the water supply. At our office in Brisbane, we have what's called an amalgam separator, which is a special trap that collects all the debris of the mercury fillings and ensures they don't get washed out into the sewerage. So why is this important? Well, 0.5 gram of mercury, that's the amount of mercury in a small size amalgam, can poison what's the equivalent of a 10-acre lake, and that will make the fish unsuitable for consumption. So you've got to ask, as dentists, are we doing enough to protect the environment? Are we doing enough to protect our own health? And are we doing enough to protect the health of our patients? And currently, I don't believe we are. Now, the things that we can do are so simple to put into place. Yes, it costs a little bit of money to buy the equipment. It takes more time to put the rubber dam on, put the airpiece on. But we just, you know, if you care, then you're going to be willing to spend that and spend that time. So, is Evolve Dental Healing mercury safe? Of course we are. We're both mercury free and we're mercury safe, and we have been ever since we started. Not one single amalgam filling has ever been placed in my dental office, and it never will be. We take every precaution to ensure we minimise the exposure to ourselves, to you, the patient, and of course the environment. Now, all those fillings that we do, whether you're electing to get your mercury fillings replaced because you're concerned about them, or you've got health issues, or it's come up that you've got high mercury levels or heavy metals, or whether we've found a weakness in the tooth, a crack or a split, or there's decay or something's broken away and we've got to work in that tooth and remove the filling, we always, always, always do that with SMART technique. So we're going to use rubber dam, we're going to use our air filtration machine. That's going to protect you, it's going to protect the team. The amalgam is collected and filtered out from our water system. We're not going to enter it into the sewerage. We don't throw it in the bin. We collect it and we store it under special chemicals, and then that prevents it gassing out, and any amalgam scrap is disposed of as hazardous waste. Now, by law, that is what needs to happen. So it tells you something that a packet of amalgam, before you mix it, before you mix the metals in with the mercury, has a poisons warning on it. The scraps that we don't use, I say we as in the dental profession, not us here at Evolve, those scraps have to be thrown into the special canister under the chemicals, and any bits that we drill out have to be collected. They can't be washed down the sink or thrown in the bin because it's now toxic waste. So putting it in your teeth doesn't make any sense to me when mercury is so toxic and harmful to our body. It's as harmful as arsenic, lead, and those sort of things. So why are we still using it in our profession, and why are we not taking the next step in those practices that have gone mercury free to ensure we're mercury safe? So if you want to find a mercury safe dentist, then you can give us a call on 07 3720 1811. Book in with us. We'll never use amalgam fillings on you and we'll always take them out safely. Thanks for being here live with me this afternoon on this impromptu video. Thanks for if you're watching the replay. Please say hello, ask your questions, leave some comments, and I'll get back to you. I'm Dr. Rachel Hall of Evolve Dental Healing in Brisbane. Thank you so much, and I'll catch up with you next time.